Doesn't your left arm? I'm gonna go with left arm.
Chest pain, obviously.
Chest pain, left arm pain, shortness of breath, sweating sometimes.
They can have shortness of breath, or they can have fainting.
Heart palpitations, faint, feeling faint.
Maybe like tingling in your arms.
The typical symptoms are chest pain, as most people know, but there can also be other symptoms. So ACT now is a good mnemonic to remember these. The A stands for arm pain, pain radiating down the arm. The C stands, of course, for chest pain. The T stands for pain in the throat. The N stands for nausea, feeling sick to your stomach. The O stands for oxygen, think shortness of breath. And the W stands for weakness. Many of these patients will feel, in general, weak, fatigued. They'll be sitting down, often not saying much.
A few minutes to an hour or longer, and you need to get immediate attention.
Seconds.
5 minutes?
It can progress slowly or it can be instantaneous.
An hour? 2 hours?
10 minutes.
Hours.
Yes, long time.
I've known someone that was having a heart attack for a few days and didn't know it.
So symptoms that would be consistent with a heart attack can often surround about 15 minutes. But remember that symptoms can start for days before you present or a patient presents with a heart attack.
No. Yes.
Sometimes women, I think, can have it on the right side, and then theirs can be like more neck pain and headaches than the left arm necessarily.
I know that there are differences, couldn't tell you what they are.
For women, it seems like they have more nausea, digestive problems. For men, it seems like, it's that crushing, heavy feeling.
Men in general tend to have chest pain, chest discomfort. They can certainly have the more atypical symptoms, but women tend to have more atypical symptoms. So be on the lookout for these other parts of the ACT now mnemonic: the nausea, fatigue, shortness of breath, pain in the jaw, pain in the throat.
If someone's having a heart attack, you first call 911.
Call 911. Yeah, try to get them help immediately. Even if you're unsure, you got to do that.
Call 911.
Help down. We ACT, so we call 911. If a patient or a person doesn't have an aspirin allergy, then a full aspirin, chewed rather than swallowed, acts best. Clearly, a patient should be resting, so placed on the ground or seated as help is on their way. Certainly, if there's a loss of pulse or a patient is agonally breathing, then either you or a medical professional licensed in CPR or a bystander licensed in CPR should perform CPR until EMS arrives.